Hello, and thank you for having me here today. My name is Dr. Michael Ryan. I'm Associate Professor of Sociology at Nazarbayev University in Kazakhstan. Let me start by thanking you again for the invitation to join today's distinguished plenary and apologize that I'm not able to join you in person, unfortunately, due to time zone differences. That said, at the end of my talk today, I'll be sharing my email for those of you who might have questions or comments, and I would very much look forward to those. So the title of my talk today is Thinking About Yesterday, Today, and Tomorrow, 10 Lessons for and from the Ongoing COVID-19 Pandemic. And I want to start by saying that 10 is a rather arbitrary number. I actually think that there are a lot of lessons that we can draw for and from the ongoing pandemic, and that's evident in the amount of scholarship that has already come out around the topic, including this conference. I myself have written a book with Dr. Serena Nanda entitled COVID-19, Social Inequalities and Human Possibilities. I've edited 2 other books on the pandemic, which are already in print. I have 4 other edited books coming out in the fall, and I am the founding and series editor of Routledge's The COVID-19 Pandemic series. So I've seen firsthand just how much scholarship has come out around this topic and the innumerable number of lessons that we can draw from the expertise that's gone into understanding the pandemic and how it's impacted our world. So again, these 10 lessons are just sort of what I think are perhaps some of the most important and what I think can help us not only inform how to get through the ongoing pandemic, but how we can think about building or rebuilding a potential post-pandemic world. So without further ado, let me jump into those lessons. A syndemic analysis is loosely defined one which combines the medical and the social. And it's important from the outset to distinguish between the SARS-CoV-2 virus, so the virus responsible for causing the disease, more commonly labeled as COVID-19, and broader references to the COVID-19 pandemic. A virus is an entity. Whether it's alive or not, something that's still very much debated. But it is an entity that infects living organisms. It requires a host to survive and reproduce. The term pandemic, on the other hand, refers to the outbreak, occurrence, and spread of a particular disease. In that sense, it has a much more prominent social connotation. There's a clear overlap there, but there are also important distinctions. Medical doctors, for example, are primarily responding to the SARS-CoV-2 virus, while politicians, economists, and social scientists are primarily responding to the COVID-19 pandemic. One way of better understanding the relationship between medical and social factors is to understand the difference between contagion issues and systemic issues. Contagion refers to how likely something is to spread, how easily it spreads, how quickly it spreads. We can think of the SARS-CoV-2 virus as something that's contagious. A systemic issue, on the other hand, refers to something that's an underlying factor in how societies operate. It's widespread and it's part of a broader system. We can think of issues of inequality and discrimination as systemic. However, one thing that the COVID-19 pandemic has made clear is that these are not 2 separate issues. In fact, we have clear evidence that systemic issues have directly informed many aspects of contagion. For example, how closely together people live, the type of employment one is or was engaged in, access to information and medical care, whose own unique relationship to each other has also become increasingly clear, and one's racial and ethnic heritage have all become predictors of one's likelihood of contracting, spreading, and dying from the virus. So while medical doctors have historically focused primarily on issues of contagion, social scientists have historically focused primarily on more systemic issues. And the COVID-19 pandemic has highlighted the value of both areas of focus, but I think more importantly, the need to put the 2 in conversation. I think we need this broader social scientific perspective then as a corollary to or a companion of the medical perspective. So I often distinguish between the virus in my writing, which I see as more medical, and the pandemic, which I see as more social. But I really don't do that to draw boundaries, rather to show how the 2 are already joined in a syndemic. These things are all inherently social. How do we classify what a virus is? What constitutes a pandemic? What does it mean to have a lockdown? What are the policy issues? I agree that things need to be more holistic. Right? We need to understand the medical, we need to understand the social, and most importantly, we need to understand them in conversation with each other. If the pandemic has taught us anything, and it has certainly taught us a lot, it is that survival is about a lot more than just staying alive. Being alive and living are not the same thing. Although it's difficult to quantitatively measure quality of life, though many have certainly tried, and there are indicators as such, there's little doubt that the measure, however measured, has slipped for most of us during the last several years. Even for those who survived catching the virus, many have suffered and are still suffering from the effects of what has become popularly known as long COVID, a condition that some estimates indicate have affected more than a third of those who have caught the virus. Truth be told, we still know very little about what long COVID does and could entail, why it affects some and not others, and if it's something that might be lifelong. One thing for certain is that the SARS-CoV-2 virus is not a little flu, nor does it operate the way that most flu viruses do. As time wears on, we'll no doubt learn more about the impact of long COVID and what that will mean for the life and livelihood of those impacted by it. We also know that people's lives have been impacted by the pandemic across a variety of other dimensions, not just those related to health. For example, the impact on education will have long-term impacts, as years of schooling have been lost for many, especially for females. In fact, the Malala Fund released a report that estimates that up to 20 million girls will not be able to return to school after the pandemic, as a direct result of the pandemic. Many institutions of education have been permanently closed. Many others have been impacted financially, reputationally, and in terms of future priorities. And the world of education has arguably been permanently altered, with many pre-existing educational divisions having been further widened. Politics have also changed since the beginning of the pandemic. A number of politicians took advantage of the moment to rouse their bases and to distract from other pressing social issues. For example, exit polls in the United States showed that the pandemic was the number one deciding factor in the 2020 US presidential election, and it's no doubt been a major factor, if not the major factor, in most global elections around the world. As other important issues have been sidelined, survival and the means to do so has largely become narrowly focused on the single issue of the pandemic. Mental health issues have also received increased attention during the pandemic. One of the few potential positive side effects, and I really hate to talk about positive side effects in relation to the pandemic, but in this case, one potential positive side effect is that we are now talking more about and paying more attention to issues of mental health. There are also issues of grief. So more than 6 million people have lost their lives to the virus. A million more have been left to grieve those losses. By March of 2022, some estimates show that more than 7 million children have lost a parent or caregiver who was living in their home to the virus. And that estimate's likely conservative. Millions more have lost a spouse, others a parent, a child, a cousin, a best friend, and losing people around us, right? So the grieving process has no doubt just begun and is likely to continue for a generation. Access to digital technology matters. The internet's a wonderful thing, at least if you have access to it. And the wonderful possibilities of having the internet have become all the more apparent during the pandemic. It's what has allowed many people around the world to continue working, to continue studying, to visit, at least virtually, their doctors, to receive financial assistance, to be entertained, to stay in touch with loved ones. It's become a literal lifesaver for many people. The internet, however, is also a highly unequal thing, and it's a thing that can make other things unequal. So for all the great things the internet has provided for many people, the inability to access the internet has also brought misery to others. Lack of access has forced many to lose their jobs or to have to continue working in jobs that require risky pandemic practices. It's greatly disrupted education. It's led to boredom and loneliness. It's limited access to medical care, financial payments, to a wide variety of issues. In some ways, the internet is, or at least could be, a great equalizer. The internet doesn't care about your race, your sex, your class, your nationality, or really who you are. It's simply a platform, albeit one generated and filled with content by individuals. In this sense, the internet has the potential to be by the people and for the people. But of course, as we know, it isn't. While the internet as an entity in itself might be neutral, it exists in a world that most certainly is not. In this way, the internet and associated issues of things like access and content can be thought of as a magnifying glass, and one that brings into stark clarity the other kinds of inequalities ravaging the world today. Comparing those with the ability to access the internet and to access it fully with those who cannot we see the expected differences in terms of sex, race, nationality, class, language, and other key fault lines of inequality, with the privileged categories in each of those dimensions expectedly outperforming their counterparts. More so than perhaps even toilet paper or hand sanitizer, the commodity arguably most in short supply during the pandemic has been information. At this point, it's important to distinguish between information, something which is based in fact, misinformation, that which is spread but is believed to be true by those spreading it, and disinformation, that which is spread but those spreading it know it to be false. As the pandemic began to spread around the world, news of confirmed cases, death tolls, and lockdown restrictions captured headlines around the world. That news stayed at the top of the headlines for at least the last couple of years, although it is, unfortunately, as I will come to in a moment, starting to fade. That said, where those headlines appeared in print, on a screen, or even in a conversation, varied dramatically based on digital access. For the more than 750 million people on the planet who are illiterate, and that's roughly 10% of the global population, there was a strict reliance on word of mouth or audio programming, television and radio to get information. For those without digital access, there was reliance on audio and adding in print information. And for those with digital access, options expanded to audio, print, and digital information. Literacy is clearly the most important factor in access to information, but digital access and digital literacy is closely gaining ground. One advantage and one disadvantage of digital technologies is that they allow, at least in theory, for access to more information. The advantage, of course, is that one can stay better informed about situations outside and even inside of their own community. The disadvantage, of course, is that digital technologies allow more people, and not just experts, to share their opinions as facts. Thus, access alone is not enough. Knowledge of how to find proper information and how to determine fact from opinion is also essential. As the world turned virtual, the term social in front of relationships and interactions began to take on an entirely new meaning. Many of the major markers in our lives, weddings, graduations, even funerals, started to happen virtually. This was all new for many of us. And even everyday events like hanging out with friends or family reunions, birthday parties, also largely moved to online platforms. What it meant to be with someone came to take on new meanings during the pandemic, both being with those inside of the household and outside of the household. This was particularly impactful on people who had difficulty accessing digital technologies or who had restrictions in their ability to be able to interact with people even face to face. Even for those with the privilege of digital access, it led to a term which has now become all too common among those of us who've lived the last several years online, Zoom fatigue. So in relation to relationships, we've seen what it means to be social change sort of in both directions. While some people had their sociability restricted, others had it expanded, at least virtually, and in ways that changed the dynamics of our interactions that are still awaiting further social analysis to be fully understood. Underlying systems of inequality matter. I've had a lot of people ask me what surprised me most about the pandemic. My answer has been not much in a lot of ways. I wasn't surprised, for example, that it's impacted people unequally based on sex and gender, sexuality, race, nationality, language, citizenship status, economic standing, all of the common dimensions that we've seen impacting inequality for as long as we've been looking at what impacts inequality. So the pandemic didn't really provide any new surprising dimensions. What it has done is to highlight pre-existing dimensions and in many ways exacerbate them. The virus doesn't discriminate. Human beings and human social systems do. We are not yet living in a post-pandemic world. In fact, we're going to be living with the impacts of the pandemic for years, if not generations to come. The impact on education, for example, the differential impact that I just spoke about based on pre-existing lines of inequality now being exacerbated, that's going to have an effect that will far outlive the virus. I definitely don't think that the pandemic is drawing to a close. People want to turn the page. We're increasingly hearing this phrase of living with the pandemic. And that makes me quite nervous for a lot of reasons. It also makes me a bit frustrated because we don't have to be living with the pandemic. We don't have to be living with this virus. We have the capabilities, we have the know-how, and in record historical scientific time to be able to wipe this virus out. Now, perhaps it sounds a bit extreme to be able to completely wipe out a virus, yet we've done it before. We've done it with polio, we've done it with smallpox, and we can absolutely do it again. The question is, are we willing to dedicate the resources and the willpower and the political leverage to be able to do so? We're still very much in the throes of this pandemic. We're seeing average daily cases rise in most countries, certainly on a global level, and to rates that we've become, I think, all too comfortable with. The current global average, 7-day global average, is a little over 600,000 cases a day. And people seem to be very comfortable returning to their everyday lives. When the 7-day global average first topped 100,000 cases a day, and I remember this quite clearly, everyone was very panicked. We were in lockdowns, we were wearing masks, we were taking all sorts of necessary health, hygiene, socially responsible precautions. We're no longer doing that, although the situation is much, much worse than it was when we were. So I think it's very important to remember that the pandemic is very much ongoing. And the less we are aware of that, or the less we act on that fact, the longer the pandemic is going to carry on. Although the early days of the pandemic were dominated by discussions about the distribution and mandated use of personal protective equipment like masks and gloves, as soon as vaccines became available in May 2020, it was vaccines that quickly came to dominate nearly every conversation about the pandemic, and with good reason. Although masks and other social measures like physical distancing can be as effective at preventing viral spread as vaccinations, they're not sustainable long-term solutions. Vaccines, on the other hand, promise a way out of the pandemic, and if properly and thoroughly handled, a way to nearly eliminate the disease or entirely eliminate the disease altogether. Unfortunately, vaccines have brought a whole new range of issues to the pandemic table, including those around mandates, priority availabilities, distribution, questions about boosters, and profiteering, among many others. Vaccine availability has also raised the ironic dilemma of how to get people who have access to actually use them, and simultaneously how to make them available to people who are desperate to get one. These are both important questions, since as long as the disease is in circulation, it holds the possibility of mutating, as we're seeing it do over and over again, into a vaccine-resistant form, as it is doing, and in my opinion, quite scarily, with the growing to be dominant BA4 and BA5 mutations. On the one hand, then, is this challenge of convincing people who have access to a life-saving vaccine to actually take it. Various methods have been tested, including lotteries, forced mandates, not allowing entry to certain institutions, and threats of job dismissal. Those methods have, however, largely failed. Key to convincing people to get the vaccine is more likely to be a strategy of re-education, or better phrase, simply education, and undoing the harm that's been caused by the mountains of mis- and disinformation that's been widely circulated. On the other hand, the question remains as to how to properly, fairly, and efficiently distribute available vaccines. So while thousands, millions of doses have gone to waste, spoiled because nobody would take them, millions of people are still desperately waiting for the opportunity to get their first jab. Nobody who studied social inequality, or even anybody who has not, will likely be surprised by the rapid inequalities of access that emerged once vaccines became available. What is also striking, though far less often acknowledged, is that this is being treated as a new problem. It's not. Humanity already has many dozens of vaccines at its disposal, and yet none of them has to date been justly distributed on a global level. We need to start rethinking the relationship between individual rights and social responsibilities. So the question of where do my rights as an individual end and your rights as an individual begin? It's a question that's taunted philosophers, politicians, social scientists, and anyone who's ever waited in line at the supermarket for generations. But perhaps at no time during the last century has the question ever been so much at the forefront as it has been since the beginning of the pandemic. Debates around individual freedoms, collective responsibilities, and global interconnectedness, which has redefined both of the former concepts in recent decades, have pushed us to reconsider how we understand who we are. When the pandemic began, there was an unprecedented amount of discussing us and expressing feelings of collectivity. As it's worn on, however, and especially since the introduction of vaccines, there's been a growing debate around individual rights with almost no mention of collective responsibilities. One reason for this growing divisiveness has been political, as any number of politicians around the world have seized on the crisis for their own political gain. Another has been truly existential questions of ethics, like how to prioritize life-saving technologies and at what cost. And yet underlying both of those dimensions has been the empirical realities of death and economic cost and corporate profiteering. In many ways, however, concern for others during the pandemic can actually be a highly selfish act. At the most basic level, doing whatever it takes to wipe out the virus for both me and you is the only way that we, even me, can move past the pandemic. The sooner I do everything I can to help you also stay healthy, the sooner I can myself get back to this so-called normal everyone keeps talking about. Sharing vaccines across borders is another example of how an act of giving can be an act that benefits one selfishly. Since the virus isn't worried about border control agents, worrying about the pandemic only within the borders of one's own country is not only selfish, it's unscientific. Just as the virus is spread globally, it has to be stopped globally. It's also important to remember that at no point during the pandemic was any government, scientist, or health agency talking about a permanent imposition of pandemic-related protective measures. Masks were never intended to be permanent. Lockdowns clearly were not meant to last forever. And while vaccines are slightly more permanent, although their efficiency is waning, as we're seeing, the mandate of vaccines for civic engagement is hardly new. In fact, it could be easily argued that the only reason many of these mandates have worn on as long as they have is because people have failed to adhere to them in the first place. For example, people who've gone out and protested wearing masks have joined together in super spreader events. People out protesting getting a vaccine or again, out spreading the virus that we need the vaccine to prevent. In sum, when we say we, and here I mean we often forget a fundamental truth that this we also includes me, and that community also includes the individual. The question raised then between individualism and collectivism, between my rights and your rights, and individual freedoms and collective responsibilities presents a false dichotomy. In each case, the latter also includes the former. I am part of the collective. My freedoms are dependent on our responsibilities. My rights can only go as far as they do not impede on your own, at least in a just society. So if we retool the original question, maybe the question we should be asking ourselves doesn't include my or your, me or you, I or you at all. Maybe the real question is, where do our rights and our responsibilities begin? And what can we do to expand both so that everyone lives in a more just, more equitable, more healthy world? The future is in taking on a more global mentality. Building on the previous point, vaccine endeavors are doomed to failure if we don't consider global responses, truly global responses. The pandemic is global. The virus isn't carrying a passport. It doesn't need one. It travels freely between and beyond borders. And until vaccine efforts do a better job of doing the same, we have no chance of stopping this. A global pandemic necessitates a global response. Now, this has broader implications for other issues as well. And it's a lesson that many people and many movements have been calling for a long time. For example, environmental movements. Pollution is also not restricted by national borders. And we're facing a truly global environmental, I don't think crisis is the right word, catastrophe. Anti-nuclear arms movements have pushed the same sort of mentality. We need a global mentality. Even thinking again from a pragmatic, selfish standpoint, loss of education and income, a downturn economy in one country has spillover effects. We already know this. So again, sometimes the most selfish thing we can do is to think about somebody else. And even if one doesn't agree with that from an ethical or a philosophical standpoint, material consequences, especially in an increasingly globalized, capitalist, interconnected world, show that that argument has merit. So that concludes my presentation for today. I want to thank you very much for your time and attention. I'm going to share now my email. If any of you have questions or comments, I would very much welcome them. And thank you very much again for having me here today. Take care.